Even though plantar fasciitis might sound like such a little problem, it can be extremely painful and have a huge impact upon your quality of life. The plantar fascia is a thick, strong ligament that is like a bowstring spanning the bottom of your foot. It lies just a few millimeters beneath the skin. It's attached to the bottom of your heel bone, then spreads out across the arch of your foot and connects into the base of your toe bones. A bit like the cables on a suspension bridge, the main job of the plantar fascia is to support the arch of your foot. Plantar fasciitis, or plantar heel pain, as it is more correctly called, occurs when the plantar fascia attachment to the heel bone degenerates and becomes thickened and painful. This usually is caused by repetitive strain in the area, such as spending long periods of time on your feet or various sporting activities. The overall shape of your foot, body weight, and other medical conditions also play a role. The most common symptom of plantar fasciitis is severe pain underneath your heel. The pain may also radiate into the arch of your foot. Classically, the pain is worse in the morning, and it can feel like you are walking on a piece of glass. In severe cases, pain can be absolutely excruciating and limits many daily activities. There are other causes of heel pain, and it is important that a podiatrist or orthopaedic surgeon thoroughly evaluates you to confirm your diagnosis. Plantar fasciitis will often respond to 3 to 6 months of rehabilitation, but you do have to work at it. A quality sports podiatrist is absolutely essential in helping you recover and hopefully avoid surgery. They will assess the shape and function of your foot and provide exercises that can offload the painful plantar fascia. Advice on footwear and sometimes even orthotics can also assist. Simple pain medications like Panadol and anti-inflammatories are also helpful. If you're not improving with these strategies, then an ultrasound-guided cortisone injection can be helpful. Sometimes after a cortisone injection and appropriate rehabilitation, plantar fasciitis may completely resolve. But even if the injection only helps you for a short period of time, it is an important diagnostic process to go through. It helps us confirm what the location of your pain is. Some patients can be a little worried about having a cortisone injection, but if it's performed by an experienced doctor, it is minimally painful and very safe. If you would like me to recommend a doctor to perform your injection, then please call my rooms and I will happily provide a recommendation. If your symptoms don't improve with non-operative management, then keyhole surgery of the plantar fascia is an extremely effective option. This takes place as day surgery under general anaesthesia, so you will be asleep. We make 2 very small keyhole incisions on either side of your foot. Now these are about 3 to 5 millimeters in size. A small camera is inserted and we visualise the undersurface of the plantar fascia and release it. Now not all of the plantar fascia is released, just the area that is thickened and painful. And this prevents the plantar fascia from pulling on the heel bone and causing that horrible pain. The released plantar fascia will then stretch out a few millimeters and heal in this elongated position. Now this reduces the tension and pain on the heel bone. Think of the plantar fascia as being a bit like a bowstring, and surgery is releasing that tension. Most patients will require the use of crutches for a few days after surgery, but you are allowed to gently put your foot on the ground and walk as soon as this is comfortable. The debilitating heel pain resolves very quickly, usually within a few days of surgery. It will literally feel like someone has taken a pebble out of your shoe. But you will have surgical pain and swelling that continues for a minimum of 6 weeks. For most patients, I recommend 2 weeks completely off work after surgery. If you have a desk-based job, you might be able to return to work within 1 to 2 weeks. If your job involves long periods of time standing on your feet, then a return would be 2 to 4 weeks, but you would need to work shorter shifts or reduce the hours on your feet. By 6 weeks, the majority of patients have returned to full duties. For sports people, general jogging can usually occur from 4 weeks after surgery, depending on your progress. A return to full sports is usually between 8 to 12 weeks. Due to their baseline level of fitness and conditioning, professional athletes will often return to sports more quickly than weekend warriors. After surgery, I recommend my patients see an experienced sports podiatrist to start early rehabilitation. This helps strengthen the feet, aid in a quick recovery, and return to pain-free exercise. I can recommend a podiatrist in your local area if you don't already have one. Plantar fascia surgery should only be considered if a period of non-operative management has failed. And like all surgery, there are some small risks involved. Your surgeon will be able to talk to you about all these risks in more detail. But as an overview, there is a small risk of infection and irritation to sensory nerves of the skin. Keyhole plantar fascia surgery has been a genuine game changer for patients. It's far less invasive than traditional open methods of surgery and has a much quicker recovery. It's also a successful procedure, with the vast majority of patients reporting excellent results. If you would like to talk to me about your plantar fasciitis treatment options, then please call my rooms at any time. If you haven't already had appropriate scans, then I can arrange these prior to your appointment.